Good evening and welcome to The Big Fight, a show that is young at 21, the oldest running debate show on Indian news television. I'm Sanket Upadhyay. As the nation fights the big fight with the virus, there's good news for India with the vaccine now in sight. But a new mutation is proving to be a headache for the parent country, the United Kingdom, and also India. The UK is in a state of lockdown, the kind we saw in March 2020. London Mayor has said that 1 in 30 in London is now COVID infected and calls the situation alarming. Responding to this fear, we in India stopped flights to and from UK on the 23rd of December. But as situation got alarming in the UK, India announced a surprise decision of resuming flight services. Add to that Arvind Kejriwal's decision of a mandatory institutional quarantine for everyone coming in from UK, and that too when some passengers were already airborne. So they learnt about this new policy once they landed. They could have planned had they known about this earlier. Now passengers are stuck at the airport, and there's a very big fear that are these decisions creating a situation that the airport itself becomes some sort of a super spreader event. So on The Big Fight tonight, this is the great strain of Great Britain. UK flights have resumed. And remember, this is going to put a lot of pressure on the Indian healthcare system if there is a sudden explosion of this new mutation. Is this Mayday for Indian healthcare? And what steps need to be taken? We'll also be speaking to passengers who are stuck at the airport. I want to introduce all our guests on The Big Fight. We have got Dr. Aviral Vats, physician of NHS Scotland from the United Kingdom. Thank you very much, Dr. Vats. Professor Sanjeev Krishna, Professor of Molecular Parasitology and Medicine. He's with us. Thank you very much, Professor Krishna. Dr. T.P. Lahane. He's the Director, Medical Education and Research in Maharashtra, because remember, Maharashtra has a different set of quarantine rules. Delhi has a different set. Dr. S.K. Sareen, he's the Director of ILBS and Chairman of the Delhi Government's Panel on COVID-19, and Dr. Arvind Kumar, Chairman of the Institute of Chest Surgery, Medanta Hospital. Thank you very much. It's an important discussion, and that's why we've got experts from the field and not politicians and political analysts to comment on decisions that have been taken. So as is the format of the show, the first round is called the First Punch, where each of you get 1 minute time to make your opening comments on this crucial issue. We'll begin with you, Dr. Vats. Your 1 minute time begins now.
Thank you very much, Sanket. My major concern with the new strain is, as we all know, it's spreading very, very fast and it's spreading far and wide. We are seeing quite concerning consequences here in UK, especially in England. As we have seen previously, the lapses in taking very, very accurate and very timely decisions have costed us a lot. I'm talking about UK here. There was no stoppage of any flights earlier back in March. There has been no very sincere efforts of stopping the virus coming from outside or going outside of UK earlier on in March. And we have done similar mistakes back in summer after the first lockdown, when we did not really go for the zero COVID, zero corona strategy or just kill corona when it was down. We opened up our economies. We opened up, we subsidized restaurants for people to go out and eat. We opened up people to go out and come in for holidays. What I'm trying to get at is COVID or corona as it is a very, very dangerous virus, as we all know.
Okay. All right. Yeah, I'm going to come back to you, Dr. Vats. This is the 1 minute time for your opening comments, so you can complete once we finish the round. Professor Krishna, your time.
Thank you for having me. Yeah, we are facing a real maximum stress on the NHS at the moment. And you're, of course, right to be concerned that this strain could be imported into India, for example, or other countries. But we should bear in mind two facts about this new strain that you've raised questions about. The first is that there are many homegrown versions of this strain being identified already. For example, different varieties in South Africa, or a different variety. And I think to an extent, there is a strength in the amount of sequencing of this virus that's been carried out in the UK. And one of the things that would be very helpful in India, for example, is if the sequencing capacity itself is ramped up to monitor what's going on, in case this variant or this something similar to this arises in India by itself. Now, limiting travel can have also itself only limited effects on importing virus. And I think that the quarantine comments you've made are also important. But I think what we should do is to be very wary and be monitoring the strains of the virus as much as capacity allows.
Dr. T.P. Lahane.
Yes, I heard both of them. See, the flights which are coming from, you can say UK, now they are resumed, but the number is very less. And as in Mumbai, it has already from 23rd of December, we have started the quarantine, institutional quarantine. And because of that, the number of the people, travelers coming from UK are very less. So at Mumbai, as on today, as the policy is very well decided on 23rd of December, the number of travelers is less, and because of that, the load of these people coming to Mumbai is reduced. But our policy is very strict that we will not test them when they come here. We will test on the 7th day, and if they are negative, then they will home quarantine, and if they are positive, then they will be quarantined for till we get the result of sequencing. So that is the policy in Maharashtra.
Dr. S.K. Sareen.
Well, your concerns are everyone's concern, and I feel that the mutant virus, once it comes, leaks into India, it will be a huge challenge. The virus is known to be more transmissible, and we may have waves coming up in end of Feb or March. Therefore, all methods should be used to curtail such things. Whatever has been the decision of the policymakers to allow the flights to come to India must have had some reasoning. But as of now, we should see that nobody actually enters India with the mutant virus. You do what you have to do. If there is a pressure, if there is an extra trouble for passengers or healthcare workers, but you have to save the country. So in that way, whatever decisions have to be taken, we must not allow this. Secondly, people who have sneaked out by one way or the other in the past, not of today, should actually come out, support the system, and get themselves or their relatives to whom they have come in contact to get them tested. So I think this is a good policy. We need to be firm, single, focus-minded. We can't let the mutant virus spread. We have to stop
Absolutely. We'll come to how policies are being made in just a short moment. But Dr. Arvind Kumar, your opening comments.
Three things. One, this virus is a very, very serious kind of mutant. It spreads so fast. And now that we are already in a phase of decline, the last thing that we can afford is this virus infecting as causing a massive surge in the numbers. And therefore, I would 100% agree with what Dr. Lahane said about Bombay policy. RT-PCR has a positivity of 70%. 30% cases may be missed if you just do RT-PCR and let people enter. So I would agree that anyone and everyone coming from the countries which are known to be having these strains must be sent to institutional quarantine for a period of 7 days, then tested, and as Dr. Lahane said, if positive, continue quarantine till they become negative, and if negative, go on home quarantine for another week. This is the least we can do to let this virus come into India, because our health infrastructure will fail miserably if there is another wave. There is already COVID fatigue setting in the entire health infrastructure, and we will not be able to face another wave.
Dr. Kumar, to that effect, I want to ask you, Dr. Arvind Kumar, are you saying that our health infrastructure will not be able to cope with the pressure of this new mutation much more than what we have already seen?
Sanket, you think of those resident doctors, nurses, and other people who for the last 8 months have been doing repeatedly 6 hours duties in the PPE. Anyone who wants to know how it feels, please come to a hospital, wear a PPE for 6 hours and come and stay in a ward. next to corona patients, you will know what it takes physically and emotionally. And health staff has been doing it for the last 8 months. Many of them have died. Many of them have lost their spouses, children, parents, and other people. And now, if the hospitals were to be struck by another major wave with more numbers, I think there will be a big problem of not only infrastructure, but health, manpower being able to. I speak with confidence because I know how difficult it is for the administrators to be able to post residents and nurses in COVID ward duties. They are literally being forced to do the duties. And if you were to have it larger numbers, it will become very difficult for the healthcare system to cope. So my humble appeal to everyone in the government and decision making, please do everything today, even if it means overreaction. Do it today to stop this virus from coming to India. If it comes, it will be mayhem.
Sure. Dr. Sareen, then could this possibly be the justification of what is now being called a random or a decision in haste by the Delhi government, that when passengers were airborne, when they did not even know that such a policy exists, you introduce the policy of institutional quarantine? What happens to those people?
Well, I'm not sure about the policies and the levels at which these are taken, but scientifically this is absolutely correct. Whether you are in air, whether you are not aware, that doesn't matter. I think we have to stop it, and as Dr. Arvind said and others, I think we have to make every effort, and RT-PCR is the only solution. So whether there is chaos, whether there is delay, whether there is a kind of difficulty the passengers would feel, I also feel bad for the airport staff and the authorities. But let this be clear, we can't let one single person add. We have 82 right now as per counts. But who knows how many have these 82 infected and how many have gone unnoticed, undetected. Generally, the rule is 1 in 10 is detected. So you are having 9 who are in the subclinical or unknown or asymptomatic stage. So you may have a fear of this spread.
Sure.
The second part of the mutant virus strategy would be that if it spreads, you may have difficulties in getting the vaccines because we don't have proven vaccines for this. So it will be much better that we do vaccinate healthcare workers and others. I'm sure you will discuss it, but faster the better, so that mutants do not enter into new people.
But I think doctor after doctor says that when vaccines are made, they do take care or accommodate the concern of there being mutations, because a virus will mutate. It will continue to mutate. So in that case,
the problem is, if you have, let's say, 100 people, 80 would be saying, yes, I will get my vaccine shot on a given day. 20 would be, no. Those 20 would be the ones who neither get vaccinated, and if the mutant virus comes, they get infected. So we are more worried about those who are not getting vaccinated, who are on the sidelines. Yes, the 80s who have got the vaccine and they get antibodies, they will certainly be having a good response to even the current mutant virus. We don't know the future. So there are 3 scenarios. One, those who have got the vaccine, those who have got, they probably would be able to maintain their antibodies for 6 months or so and would be safe even against the mutant. Those who have not got the vaccine, and therefore I appeal everyone, we have to have 100% vaccination. Community participation is bigger than government participation. If those 20% never get vaccine and they get the virus, and especially the mutant strains, we may have a new surge of different kind of viruses coming up. The third part is that after vaccine, at least one shot should be given to everybody as fast as possible. And in India would have enough vaccines, I have sure, in the amount that the Indian vaccine people can make it.
Professor Krishna, let me come back to you. As someone who represents the Infection and Immunity Research Institute at St. George's University of London, I want to ask you, when things are said about this new mutation, that it spreads faster than how we know the virus to spread, what is the scientific evidence to back this claim? I mean, does it have a known record of a faster spreading are effective? You know, like
Yeah,
one person will
that's
infect how many?
Sanket, that's an interesting question, and the way it is originally noticed is that you had your original variants or your pre-existing variants of the virus, and then when the sequencing efforts are put into place, initially in September and then over the subsequent few weeks and months, what you noticed is that the proportion of virus with this new variant sequence B117 started to increase, and it increased very quickly. And when you look in those areas where the infection, the COVID-19 was increasing in different regions, this was correlated with the presence of B117 as compared with the other sequences. Now, the other facts are that this does multiply more quickly when you culture it, and also the early evidence is that when you monitor for the amount of virus that people are carrying, this variant has a bigger burden of virus in the places where you sample compared with existing virus. Those are early results. But can I come back, please, to one general point?
Sure.
And that is a very important point, which is, no country wants to import any coronavirus, especially, of course, this more rapidly propagating type of virus. And no country also, equally, I think, wants to export it. So what do we need? What we really need is not only a country-based strategy, but we need an international strategy, don't we?
Well
we
said.
need a strategy that deals with aeroplane transport, it deals with shipping, it deals with overland transport. We need a coherent strategy which is validated to test and trace, isolate individuals. And now we have the tools coming out to test effectively and quickly as well.
I think that's very interesting. That's a very, very interesting suggestion. And, 10 or 11 months down into the virus, one would have thought that this should have already happened. But Dr. Aviral, I want to come to you now. As a physician with NHS, how much of a burden on a very robust system called the National Health Service in the UK is this new strain? Because if it is a big strain on an extremely robust healthcare mechanism in the UK, I only shudder to think what sort of burden it will put on the Indian healthcare system.
So indeed, it is a huge burden. And if we look at the numbers, I was just reading about them today, I think it is 8 out of 10 cases are of the positive cases are of the new strain. And the last number I remember was that anywhere between 4 to 6 beds per 10 beds are filled up with the COVID cases in England. So the numbers are increasing very, very fast. In Wales, 1 in 4 tests are positive. And the percentage of new strain occupying the infection is anywhere between 60 to 80%. As Professor Krishna mentioned, there is enough data from the epidemiological side that it is highly transmissible, although we are still waiting on the lab data to actually confirm that it is that quickly transmissible. But nevertheless, this virus has taught us that we have to act as fast as we can. And just to get the basics clear, the key in controlling this virus is to break the transmission. That is not only important in stopping the spread of the virus, but it's also in preventing the mutation of the virus. Because the more the virus transmits from one person to another, there is a higher likelihood that it gets mutated. There are more strains being reported from other parts of the world, which can be even more concerning. So our prime focus should be on how to stop the transmission at all levels, be it international, be it domestic, be it at city level, be it at community level. So from simple using of masks to stoppage of flights to rolling out of vaccines, to ramping up the testing facilities, as Professor Krishna mentioned, that UK sequences almost half of the world's sequencing being done on coronavirus, and that's why UK was able to pick it up. Now, this virus mutation has been seen in other countries even before UK picked it up. So it probably is already spreading very, very widely. It could be we have only tested 100 cases in India. It could be that it's already spreading. how do we attack it? Again, the same thing, by breaking the transmission, and that is the only way we can reduce.
I want to ask you, Dr. Aviral, you're talking about breaking the transmission. Now, vaccination started early in the UK, earlier than other parts of the world. Has that had no impact, or is this too early to be even talking about an impact of the vaccine?
No, there are a couple of factors to keep in mind regarding that. One is that indeed UK was the first one to approve and then roll out the vaccine program. But by then already the strain had started spreading from September, early October. And by the time it was mid-December, I think 60% of the cases in London were from that strain. So we were already a bit late, and then came the festive period wherein the restrictions were not that strict. And by now people have also become a bit lax with the restrictions, with the precautions. Now, if we add, and also there were youngsters were also, let's say there were more parties, and there was 2-meter distancing and masks and all that were not followed religiously probably. And all those things played a role in the spread of it. And now it has spread, and now the worry is that we are waiting for at least another 2 to 3 weeks time before the peak starts to come down, not come down completely, starts to take a turn towards coming down, and then we are looking at further another maybe a month or 2 months that we get back into the levels which they are manageable. Sorry, just one thing to add is about the vaccine. Vaccine is going to play a role in it, but it needs some time. For example, UK has started rolling it out, but for now, we have only been able to do around 2.2 persons per 100 people. So which is around just under 2 million people have been vaccinated. So this needs to be increased at a larger scale.
This needs to be ramped up.
Again, we have to another 2 months.
Two things that have been discussed here. Professor Krishna's comment on an international coordination as far as strategy building is concerned. Dr. Lahane, the problem is that many would argue that here we are grappling with a national coordination, because what you saw right now, the central government decided something on resuming the flight service, and then the Delhi government came with an announcement. So I don't think this was pretty well planned. Now, Dr. Sareen says that you forget that scientifically this is important. This is not the time to get into, what would have been appropriate. You have to do the right thing and fast. So there will be problems. But Dr. Lahane, do you think that the time has now come to at least, and it used to happen initially in India. You had this center and state coordination. Do you think we need to go back to doing that regularly, just like it was done in March, April, May 2020? It's not happening now.
Yes, I think, Sanket, it is what we are saying is very true, because the coordination is very much important, and this coordination in the state and the central government is necessary now, because it was there in the March, and once the center announced, all the states were working together. So like that it should happen, because what we are discussing is now this new strain, what strain is coming. So this is a more virulent. It means infection is much more. It means it infects more than, you can say, 14 people who are in contact with out of 20. It means if you see, it is not like a gum, but it is like a pevicol. And so because of that, we will have to avoid such type of virus. And I think in India, as you see the health system, and as we've been discussing, it is very difficult, because all the health workers are very much tired by working 9 months. And I think we must avoid such type of strain, which should not come in India, as now we know.
So going by what you are saying, Dr. Sareen is saying, what Dr. Arvind Kumar is saying, it's very clear that the flight services should not have been resumed.
Yes, I think so. Flights, it should not have been resumed. But I think there may be some international things that may be there. There may be some, you can say, policies, national policies.
Much more than health?
That, health is very, very important. So this will be, one should not compromise on the health. So maybe you can change the policy.
Let me get in a view. Dr. Kumar and Dr. Sareen, one by one, do you feel that this flight service should not have been resumed? After all, how long will you keep it banned? Because see, if the peak comes only in February, according to some estimates, should we keep the flight banned till February? or after? Dr. Kumar first.
Sanket, we have to stop this virus from entering and spreading in the community at any cost.
At any cost.
It's very clear that the country cannot and at no cost can afford the health infrastructure, and the health manpower will not be able to support another massive wave of corona cases across the country. And I say this after having seen the working of one of the two largest COVID hospitals in the city of Delhi. The state of the health workers is such that if we were to face massive number of cases across the country for another few months, there's going to be a breakdown, not because of infrastructure, because of acute shortage of manpower. People are physically tired, emotionally tired, they are drained, and they will not be in a position to sustain the level of healthcare which will be required if we were to hit. So therefore, the bottom line is that situation has to be prevented at any cost. And what do? You have to prevent this infection from entering, and whoever people have all entered, they have to be traced. You put CBI, you put army, you do anything. Trace them,
I'm sure that
arrest them. People who have run away from airports should be treated like terrorists. They are actually endangering the life of the country.
Dr. Kumar,
trace them,
surely
get them into quarantine.
Dr. Kumar, surely they are not terrorists. It's just that they fear institutional quarantine. But, you know, I get the sentiment.
But Sanket, they can cause as much damage as terrorists. Maybe they can cause more deaths than terrorists. If one person goes and infects a city, you may have more deaths than a terrorist will cause in Kashmir.
No, so it's very clear that according to you, the resuming of flights was not a very wise decision. But Dr. Sareen,
I would have waited for some time.
Yes, Dr. Sareen, do you agree? Flight services could have waited?
There are two ways of looking at it. We have forgotten what we were going through in the summer and autumn last year, that whoever was coming from overseas was in quarantine, was kept for 7 days to 14 days, whatever was, because RT-PCRs were not that readily available. So people were just in quarantine. So I think it's not very painful just to be in quarantine and be tested. So flights, if they have to be for some reason or the other, because our positivity rates may be, let's say, 5% or so, but for that 95% of the other group of people who are not infected will also have to be in quarantine. If that is acceptable, that both the groups, infected and non-infected, are for quarantine for 7 days and get tested, and if positive continue, I think that is a policy which was there earlier. So let that be there, but the bottom line is we will not and should not allow anyone to enter the cities with an infected corona, especially if it is a mutant coronavirus. There are many side effects, bad things in that. The morale of the people will go down. People will feel that, well, we have been wearing masks, we have been doing all those kinds of things. What has happened to that? For common citizen of the country who has for 9 months done all that patience, do gaj, haath dhona, mask lagana, all that would go in vain. So therefore, for rest of the country, for those who have lived all these months with pain and hope, I think we should not let anyone come.
No, Dr. Sareen, there is a study by the CSIR DG, Dr. Mayday, and that study says that it has been observed that countries that have a better hygiene standard have had more deaths and more coronavirus cases. I'm sure you must be aware of this study. And it says that in countries like India, where the hygiene standards are poor, the body has responded better and has been able to build a better immune system, thus preventing coronavirus fatalities.
Yes, I am fully aware of Dr. Mayday's paper. And that is a common philosophy that at early age in life we are exposed to different kinds of foods, different kinds of maybe infections which come with the street vendors' foods, and therefore you get immunity. Your antibody system is trained. It is called trained immunity. So you have trained your immunity to multiple exposures, and that's why you may handle it, and that's why it can be beneficial at times.
I Dr. Sareen, I joked with him. I asked him, "You're certainly not suggesting that we stay filthy, are you?" he did not seem to like it, but yeah.
And also, it doesn't mean that any new virus to which we have never been exposed, we will be as strong.
Sure.
So I think there is some message from his study for common things, but maybe for corona, we should be more careful and do not think that since we have poor hygiene, we cannot die.
Yeah.
Maybe this is, I mean, we should be as cautious as we were before, and maybe more cautious with mutant
if
virus.
not more, because you know, filth also affects the immune system. Immune system goes weak, and if in a weak immune system you get attacked by a new strain, far more infectious strain, then God help us. Professor Krishna, very quickly, I know this is not in your area of expertise, but as a general observer, would you like to tell us, if you're aware, what really is the policy as far as flights to and from England is concerned? Is this a world policy of a flight ban from UK, or do countries operate flights?
Well, countries have their travel corridors. So they permit flights to and fro, and obviously, you know, for good reasons. When people are in lockdown, you have to have strong, valid reasons to travel for countries where there isn't, for example, even if there is a travel corridor. No, my plea is, look, two things for India. Please monitor the virus sequences, because you can spend all your efforts trying to keep, you know, B117, this variant strain, out, but you might grow your own, and you need to be able to recognize it. So that's very important, to be able to sequence effectively. And then the second thing is, it's a global issue, and we need to have coherent policies. If you go to South Korea, they are meticulous in the way they handle anybody coming from any country, but they put a huge amount of resource into handling each individual, and they don't allow contact until somebody is confirmed on repeated testing to be negative. So we have the tests. What we need are the policies, internationally, nationally, and also, of course, even within India itself.
Which is very important. Dr. Lahane, now I want to come back to you. Just taking off from where Professor Krishna left, he seems to say that you've got to put in a lot of resources and study into understanding effectively these mutations and outsmart the virus. Now, I don't think we are doing that. We are following the virus. For instance, even now in this country, the number of rapid antigen tests are alarmingly high, and we know that they're not reliable. So do you think that this is a mistake that we continue to do, even when a new mutation is staring at us?
Yes, very true, because this rapid antigen test should be reduced, because this rapid antigen test is giving the wrong results, that those who are negative, they are thinking they are negative. So it should be an RT-PCR, and so RT-PCR should be the only test today also, and that test should be done. So I think here also in Maharashtra, we are reducing the antigen test and we are increasing the RT-PCR test. So that is very important. And secondly, for the people who are coming from outside, here we are doing definitely sequencing for the Europe people who are coming positive. Here 11 patients came positive, 4 from Pune and 7 from Mumbai. So we are done the sequencing of all those who came positive here. So I think we must follow that. We must follow the virus, and not only the thing that we must also research on the virus, that how we can avoid this.
But is that
and
not
secondly,
happening already, I wonder?
Yes, it is happening definitely. It is happening definitely, because since March we are doing that, different type of sequencing we are doing. And today what is required is the vaccination, because if this new virus enters by any means in India, then the health workers should be safe to go and treat the patient.
No, but then many people say that we do not even know whether the existing vaccine will be able to tackle a new mutation.
No, new mutation will be tackled. See, Sanket, new mutation will be tackled by the vaccine, because in mutation only change happen in the S protein, and change is not happening in the proteins totally. So RNA as a whole, it is as it is. So it is not changed. So in you can say in HIV, RNA has changed, because of that there was no vaccine. But we are lucky that in the COVID-19, the RNA has not changed, And so it is going to work. Vaccine is going to work with the new strain also.
Okay, my last comment, let me quickly get in a view from all the doctors very, very quickly. We'll begin with you, Dr. Aviral. The point that Professor Krishna made of an international coherent strategy, do you think that this is a global failure? That we've wasted quite literally many, many months in not developing this? I mean, countries are talking about it, world leaders are talking about it, doctors may be talking about it, but where is that? I mean, an organization like the World Health Organization could have done this. Right? We've got agencies. Is it not happening already?
No, I totally agree with the idea that the more the global coordination, the more the coordination at any level, the better it is in this fight against corona. And you mentioned WHO. WHO has been trying to do quite a lot of coordination, I must say. We should give fair credit to them at the international level, be it vaccination, be it clinical trials, be it disseminating information, be it highlighting things. And they have also been highlighting the fact about how to manage the flights and how to open them, how to have guidelines and all that. But again, every country is a sovereign country and they want to decide on their own. And this we have seen the huge differences between how, for example, New Zealand has dealt with the situation, or even China has dealt with the situation after a while, or in how UK, US, and India has dealt with the situation. So we have to learn from that. And again, the larger the transparency, the larger the coordination, the larger the testing, be it RT-PCR, be it sequencing. Those are key things. And not only this virus, any virus, we have to go after it. These are our tools till we get a potent vaccine rolled out to enough population.
Sure. Last comment, Dr. Arvind Kumar, I want to ask you this question. An international cohesive strategy or coordination where countries can just come and share their experiences. I don't know whether that happens already or not. But should that or should that not happen?
No, ideally, there should be an coherent international policy. And I think, Sanket, there has been, in the first few months, there was a significant laxity on the part of WHO, which we all know. But I think in the last 6 months or so, there has been continuous policy advices, guidelines coming. But I don't think there could be a body which could be acting like a big brother and ordering, because specific requirements of countries may vary. And therefore, some amount of laxity will need to be given to each country. But by and large, policy guidelines have been coming from these international.
I think what was proposed is a sort of a coordination committee where people can learn from each other's experience and not really dictate.
But there are different international organizations, and the WHO has been. If you remember, just about 6 weeks back,
countries ridicule WHO. What do you do? I mean, there are
no. Ridicule is different, but let's see, in the last 4, 5, 6 months, just about 6 weeks back, there was a message from DG that the coming 4 to 6 months may actually be the worst period of corona. And we all were wondering that the numbers are coming down and why has WHO given this warning? And now see, it seems to be turning out to be true. So they have been issuing correct warnings also.
Okay, I've run out of time, but thank you so much for this extremely important, engaging and informed discussion on the new strain, the great strain of Great Britain. We have to arm ourselves with information, and only these wise men can help us do so. Thank you very much, Dr. Aviral, Professor Krishna, Dr. Lahane, Dr. Sareen, as well as Dr. Kumar for joining us. Stopping for a short break on the Big Fight. When we come back, we'll get you what exactly is happening right now on the 8th of January 2021 at the New Delhi International Airport, at the Indira Gandhi International Airport. It's a result, I mean, Professor Krishna was talking about an international strategy. This is a result of the lack of a national strategy. Chaos at the airport. Passengers give their first-hand account right here on this show. Stay with us. There's a crisis that emerged because of the government's decision to resume the flights and the Delhi government's decision to ensure that there is an institutional quarantine of 7 days even for all those passengers coming from the UK who test negative. Now, this has created quite a situation at the Indira Gandhi International Airport, New Delhi. We have some passengers who are now connected to us from inside the airport. I want to go across now to Saurabh Datta. He has arrived from London. He has an infant with him. Saurabh, can you hear me?
Yeah, I can hear you. But the voice is very feeble.
Okay, Saurabh, I'll try to be as loud as I can. Would you like to tell us what exactly is happening right now? For the benefit of our viewers, this is Friday, the 8th of January, 2021, and we are recording this interview at 7:15 p.m. So as of this moment, Saurabh narrates what he went through. Saurabh, please go ahead.
Yeah, right now at 7:15 p.m., it is exactly 8 hours 15 minutes. We landed into Delhi after a flight of 8 hours. So equally 8 hours flight and 8 hours into Delhi. We provided the sample. Still, everyone not received their test result. So this is what it is right now. So all the passenger, 246 passenger, waiting into the same lounge for last 8.15 hours.
Saurabh, have you heard from any representative? What are you saying? You have an infant with you. Are you being attended to? What is the problem?
Right now, no government. Only official news was 7 days of quarantine for everyone, even if we are negative with RT-PCR. For your information, all the 46 passengers were carrying RT-PCR negative test, which was done in London. So all the passengers were negative. After landing, we did the test, which is also negative for most of the passengers. As I am hearing, all the passengers are negative as well. So after this, where we need to go, what to do, there is no proper guideline till now.
Where exactly at the airport are you? So you have completed your immigration, you're out. Where exactly? Because, you know, my point is, while all of you have tested RT-PCR negative when you started from London, and now that you've reached here, it could be a potential risk for you.
That is my exact question. So, my question to Indian government, that are we not relying the test which we have done in UK, or we are not relying the test we are doing into India? So even if both the tests are done into a span of 72 to 72 hours, why all the passenger has to go into institutional quarantine? And second question from me to government is, if it is a directive from authority of Delhi, disaster management, Kejriwal and team, then how they can stop the transit passenger who doesn't belong to Delhi? Suppose I belong to West Bengal. How can they put a guideline SOP for Delhi, which is published for Delhi? How can they ask to abide the same SOP for other state? This is not correct, because we know there is another SOP for Maharashtra. So Maharashtra passengers are following those SOP, but Maharashtra is not pushing other passengers to follow that same SOP. We are not entering into Delhi. So if Kejriwal is tweeting that we cannot put the lives of Delhiites into danger with the new strain of UK coronavirus. So for your information, Mr. Kejriwal, we are not going out of the Delhi airport. We are only taking our next connection flight to Delhi. I already have the boarding pass of 4:30 flight, which is already gone to Calcutta.
So you've missed your flight. So, earlier this afternoon, you missed your flight.
I already missed. All the passengers have missed their connecting flight, whoever has the connection. And my question is, why? How? If I saw the Kejriwal into it, that he says to avoid the danger of Delhiites from UK new strains of coronavirus, we have to put all 246 UK passengers into isolation for 7 days. But we are not going outside Delhi. We are not going outside of the airport. So how it is justified?
Saurabh, can I ask you? Can I ask you something? When you left from London, did it not occur to you that flights are resuming? Why are they resuming at a time when London has gone into the lockdown we saw in the month of March and April 2020? Did it occur to you at some point that why are flights reopening?
No, actually, my initial booking was on 26th of November. But when the Indian government has closed the border, then the flight was rescheduled to 2nd January. Then again, they extended till 7th, so my flight got rescheduled to 9th January. Then again, it got rescheduled to 7th January. So the flights got rescheduled when our aviation minister has tweeted in Air India side that there will be a special flight for Delhi. So there will be a special flight all the other connections, because they have stopped the Kolkata connection. They are only operating through 3-4 cities right now: Bombay, Delhi, and Bangalore. So all the connections are from there only. So governments already know, Delhi CM already knows. So why before boarding the flight they are not publishing the SOP? My simple question is, if I don't have any problem with Kejriwal, with CM, with these SOPs, but they has to be published before the flight is taking off, so that we are all comfortable and we are all aligned with the SOP. And we know what we need to do after landing to Delhi. They cannot simply change the SOP when we are flying above 10,000 feet.
Absolutely.
This is not acceptable.
You cannot quite literally leave people hanging. I agree with you, Saurabh. Right. Do stay on with us. Yeah. At 7:21, for the benefit of our viewers, at 7:21 p.m. Friday, 8th of January 2021, we are also interviewing Shaju Jose. He has also come from the same flight. Shaju, good evening. Can you hear me?
Good evening. How are you?
Great. Shaju, what about you? Would you like to narrate your experience?
Well, our experiences are the same. We came by the same flight. At no point we were aware that we would have to go for institutional quarantine, even though we tested negative in London and tested negative here. It is only in the last 1 hour or so they have been printing out the test results of the swabs collected here. It took about 6 to 7 hours to complete the entire flight, which was full. And as the previous speaker was saying, there are lots of people, and a lady here, she is here with me. I don't know if you can see her. This lady came for a funeral, and she took a business class ticket so that she can get here. And she's been so desperate, and she wants to go, but you know, we all expected a home quarantine, but when there is a death in the family, you can still, you know.
Can you, I know, I mean, our heart goes out to the lady, but would she like to narrate her her ordeal? Would you like to speak to her on our behalf?
You are on NDTV live. You want to tell them what is happening? बोलिए.
इधर हम खड़े हैं, हमारे को रिपोर्ट ही हमारा नेगेटिव है, तो फिर भी इन लोगों ने हमारे को कोई कुछ नहीं बोल रहा कि हमने क्या करना है क्या नहीं करना. हमारा फ्लाइट 10:30 बजे का लगा है, तो डिस्टर्ब कर रहे हैं छोटा छोटा बच्चा और प्रेग्नेंट वुमेन्स, एवरीबॉडी हियर, बट दे डोंट केयर, दे डोंट बॉदर, बट एवरीबॉडी shouting and screaming, but negative people, they don't go out.
Could you hear her?
Yes, I could. And this is a terrible situation for all of you to be in. I want to know from you, what exactly are the arrangements that you have managed for yourself? Because, you know, obviously you were unaware that there will be an institutional quarantine. And even if there is one, you're not being taken to one. You're stuck at the airport. Why is that the case? Have you asked the authorities there? Why are you at the airport?
Precisely. A few minutes ago, I approached one of the officials here and I asked him, please tell us what's going to happen next. Now you have got the results. And what he's saying is some government officials will come and let you know. That is the results, answer we've been given all through this saga, starting from 11 o'clock this morning. Officially, until now, we have not had a single word. All what we are hearing is from individual officials, whatever they wanted to say. So they are not telling the whole truth or the whole fact. All what they're saying is someone will come and inform us.
Shaju as well as Saurabh and the lady you made us speak to, well, let's hope that the government is listening and we have a solution very quickly. Let me, for the benefit of our viewers, also tell all of you that if you watch this program in a repeat broadcast, this has been recorded at, and the time right now is 7:25 by the studio clock on Friday, the 8th of January 2021. So as of this moment, this is the situation where passengers find themselves struggling because there is indecision on the part of governments. Stopping for a short break, but news and updates will continue on the other side.